So I think the major update over the last 2 years is how we diagnose CMML, which has been defined a lot more broadly than it used to. And so, just by definition, a lot more of our patients will be classified as CMML. Is it the right criteria? Should we change it? I think there's still a lot of open questions. But how we define and how we diagnose CMML has changed. And then I think what I tell people is, even though there are so many questions to be answered, I think more than ever, for a variety of reasons, there is a growing community of CMML researchers and industry partners who are really interested in developing new drugs for this disease, and we desperately need some. So while we're in early stages of a variety of clinical trials in CMML, often many of these clinical trials are actually repurposing a lot of the drugs that have been approved for myeloproliferative neoplasms. But um, I'm very optimistic that, in the next year or two, we're going to see, many CMML, dozens of CMML studies in the near future.